This lecture is going to address cellulitis. Cellulitis is an acute bacterial infection of the dermis and underlying tissue. So an infection of the skin and the underlying tissue, like the fatty tissue. And it can even go deeper than that if it isn't treated properly. So this infection occurs when normal flora of bacteria gain entry into the dermis through a break in the skin. So normal flora would refer to bacteria that just kind of normally live on the skin. And then that bacteria, once it gets into a break in the skin, multiply and it causes an inflammatory response. The most common organism to cause a bacterial skin infection or cellulitis is Staphylococcus aureus. Cellulitis can also result from nearby abscesses and sinusitis. So an abscess is basically a pocket of infection in an area, and that pocket of infection can spread into the skin and underlying tissue, and it just can spread. And then sinusitis is like an infection and inflammation of the sinuses, and it can also result in cellulitis. All right, so risk factors of cellulitis. So children are higher risk because they're more likely to have trauma or injury to the skin. And then that, any break in the skin just greatly increases the risk of getting cellulitis. Impetigo is a bacterial skin infection that can definitely result in cellulitis. It's a very highly contagious infection that is spread, especially in younger children. Folliculitis is a common situation that children experience. That's like an infection and inflammation of like a hair follicle. Also, untreated tooth decay can result in cellulitis. And then otitis media, which is like an ear infection, can result in some cellulitis. Older adults are also at an increased risk because they have thinner, less elastic skin that is more susceptible to injury and skin breakdown. Clients with peripheral neuropathy have decreased ability to sense anything in whatever area is being affected by the neuropathy. So it's most commonly the feet and lower legs. So if I have peripheral neuropathy and I have diminished sensation there, I could possibly step on a nail, which would cause a break in the skin, and then I might never even know it and know to look at it. So that's why. Reduced physical activity. So, if someone is sitting or laying in an area for a long period of time and they're not able to reposition themselves, then they're at an increased risk for skin breakdown, which puts them at an increased risk for cellulitis. Malnutrition, as well as dehydration, those factors both put someone at an increased risk for skin breakdown, which then increases their risk of cellulitis. And so then I think we've already established any interruption in the skin increases the risk of cellulitis because bacteria could get into that opening in the skin. So illnesses can also compromise skin integrity. Specifically, the illnesses that can do that are diabetes, obesity, if someone has a previous history of cellulitis, peripheral vascular disease, fungal infections of the body, all those tinea, like there's tinea corpus, which is like a fungal infection of the body. There's tinea pedis, which is a fungal infection of the feet, commonly known as athlete's foot. Any of those fungal infections increases the risk for cellulitis, as well as anyone with a weakened immune system. So if someone has a chronic illness that's causing a weakened immune system or is receiving chemotherapy that's causing a weakened immune system, then that client's at an increased risk for cellulitis. Okay, so we've clearly already established that patients with a skin wound are at high risk of developing cellulitis, so it's really important that good wound care is provided to prevent infection. And then skin protection is also important, and to prevent further skin breakdown is important. So there I have listed the clinical manifestations of cellulitis. So one thing I want to say about this is that it is a very rapidly progressing illness. So let me give you an example of what I mean. I got bit by my cat several years ago on my hand. The wound, it was an opening in the skin, right? Cat bites, any animal bite is high risk for infection. So I did develop an infection. I developed cellulitis. I was on an antibiotic that was not effectively treating that infection. And I went into work that morning and the redness was probably up to my second knuckle on my finger. And by noon, it was spread to almost my wrist. That's how quickly cellulitis will spread. So it's very important to recognize it and to make sure that clients are being properly treated. So all of those symptoms, including the lymphadenopathy, that's the enlarged lymph nodes, and the inflamed lymph nodes, the lymphangitis. So realistically, the diagnosis of cellulitis is based upon the client interview and the physical examination of the client. The physician's going to see the client, going to assess the client's skin, and going to be like, "Oh, you have cellulitis because it looks like cellulitis, and you told me you got bit by a dog, or you were swimming in a pond after you cut yourself." So that's how they're going to realistically make that diagnosis. Other diagnostic testing that they're going to look at is they're going to get a CBC because, like we talked about in the infection lecture, they're looking to see if there's an elevated white blood cell count. They're going to do a culture of whatever body fluid. So they might do a wound culture, right? That's probably most likely, to see if it grows any type of bacteria or microorganism. And then they're going to do blood cultures. If the patient has like a toxic appearance and looks like they could have sepsis, they would do blood cultures to see if there is the presence of microorganisms in their bloodstream causing a systemic infection. So your nursing assessment of these patients is to obviously recognize the infection. You want to assess their skin frequently. You're going to assess for signs of systemic infection. So that would be, fever, aching, general malaise, those types of symptoms, and symptoms of, systemic inflammation. You're going to assess their vital signs regularly, and you're going to trace their borders. We'll talk about that on the next slide. And you're going to, get a health history to determine if the client has underlying conditions that may increase their susceptibility. So maybe they have diabetes. Diabetes really increases the risk of infection. Okay, so tracing cellulitis borders. So this is done. So it looks like they essentially took a marker, an ink pen, and they outlined all around the red area. That red area is the area that has cellulitis. The reason why they traced the border is because I talked about how quickly it spreads. They want to monitor it to see if it spreads beyond that border. And there are special skin markers that are used for this purpose. So if you trace the border, and this is often done by a nurse, sometimes a physician. I've done this multiple times per physician order. But if you trace the border and you go back and assess your patient in a couple of hours, the redness has extended beyond the border, then you're really pretty concerned at that point, because the cellulitis and the underlying infection is spreading. And realistically, if this worsens, it can spread even into their bone and cause things like osteomyelitis, which would be an infection of the bone, and that would clearly be not a good situation for this client. It could result in an amputation of a specific area. Okay, so how to treat cellulitis. You want to reduce infection, promote comfort, try to prevent complications, essentially by treating the infection. Collaborate with family members and other members of the healthcare team. You want to make sure the client gets adequate rest. Elevate the area that's involved. So if it's their foot, you want to elevate that area because there's probably going to be some edema. And then obviously infection control measures are important to not expose the patient to any additional infection, and to also not expose others to the patient's infection. So if they have a seeping wound, containing that and washing your hands is really important so that you don't spread that bacteria to others. And sterile saline dressings would be indicated if there's a large area, if there's an open wound of any significance. Sometimes cellulitis can start and the wound can be very minimal and minor, but sometimes it can be a little more of a significant wound. And then pharmacologic therapy or medications. So realistically, it just depends on what the severity of the cellulitis when the patient first presents to wherever, the urgent care, the ER, wherever. A lot of times they'll try to treat the patient with oral antibiotics and send them home to see if that will effectively treat their infection on an outpatient basis. And if not, then the patient would then get systemic antibiotics, be admitted for IV antibiotics. So, and then as we talked about in the infection PowerPoint, the type of antibiotic that the patient is going to get would really depend upon the microorganism that's causing the cellulitis. So as we discussed previously, the majority of cases of cellulitis are caused by Staph aureus. So most providers are going to select an antibiotic that will effectively treat that bacteria. And they will do a, culture the wound if there is a wound that's significant or draining. And then they'll see what bacteria that culture grows. The culture takes 48 hours to 72 hours to come back. And then if it shows that it's something different than the Staph aureus or whatever microorganism, then they may have to change that antibiotic to something different. So recovery begins within 48 hours after antibiotics are started. And antibiotic therapy really needs to continue for at least 10 days. And then, like I said in the other lecture, clients definitely need to take antibiotics at the same time each day. They should try not to miss any doses, and they need to take their full course of their antibiotic therapy so that their infection doesn't come back. So this is important information to include in client teaching. This is straight out of your book. I'm not going to read this to you because I know that you can read it. But this is important information to know so that you can appropriately educate your clients. And that is the end of this lecture. Thanks for listening.